Oh yeah. You know when when I have a complete blank and I forget what I'm doing. And then I went on the refeeding program. So during my first few years within the mental health services, primarily probably about all my 20s, the focus was on food, what I was eating, what I wasn't eating, what were fear foods, what was this. And it wasn't about guidance on health, nutrition, building a positive relationship up with food or with your body. For me, my experience was very much eating to put weight on. So it didn't matter what you ate, how much you ate. To be fair, I learned that eating food was a way to suppress emotions and feelings. Because if I was in hospital and saying, "Oh, I'm worried about this, I'm worried about that," oh, just stick to your routine, stick to your diet, or you'll be all right. It's because you're not eating properly and stuff. So I'd end up eating more or eating what was in my care plan, but then sort of saying, "Can I have a snack?" just to put weight on so I could get out of there. Where other patients were saying, "Don't introduce snacks. I'm not eating this. I'm not eating that." I was like, "Just give me it. Give me it. I want to get out of here." And that was like, "Yeah, go on then. Have another pudding. Have this. Have that." Till I got to a healthy weight. So I think my first.
It looks like, sorry, the image that you've kind of given me from what I've said is it's still really not about you.
No.
It's about calories. As you know, that there are no calories in nature and we're nature. So I don't believe in that kind of thing. And calories don't exist because ultimately the proof is in the pudding from what you've just said is that if you get to a number, a figure that somebody decided this is how much everybody needs to weigh and they'll be healthy, and this is how much everybody needs to weigh, and they'll be unhealthy, and this is how much everybody needs to weigh. But somebody else decided those figures. So ultimately, it's a paradox in itself. It doesn't make sense that you're eating this food to say you're at a healthy weight. How can you be at a healthy number for us? So it's for us, it's not for you, because we're not checking inside of your body the impact that junk food is having on your body, your mind, your emotions, your microbiome. None of that is being, we're not interested in that. And so it's that way. If you say like you stood on the scales and you just ate a purely healthy diet, you just switched your diet and went to eat a purely healthy diet, and you'd be told there's these rules and everybody's in this little prison box of you can only lose £2 a week. That's a healthy weight loss is £2 a week. But if you just switched your diet, yeah, and then started eating really, really, really healthy, the weight would begin to drop pretty fast. Now then they'd be concerned that you're underweight. You're underweight because we have these figures. But how would they know your body? Your body knows its natural weight. So your body will know where its natural weight is if you know as a person what you're putting in your own mouth. You know that you're putting the good food in your own mouth, you know that you're putting lots of it in your own mouth, and yet your body stays a certain way. Yeah? And then this is my experience, that everybody then starts to say, you're underweight, you've lost weight rapidly, there's something wrong. What if it's that there's something right? What if it's that I've got rid of the toxins and stuff like that? Do you see what I mean? But it's not looked at, food's not looked at like that. It's looked at such a massive argument that goes on of you should eat this and you should eat this and you should eat this. Or if you don't eat meat, you're going to be attacked for not eating meat because you should eat meat. You can't survive without meat, even though people survive without meat. You should eat that. And it shows you that if you don't eat meat, you're not going to say to people, don't eat meat. You can eat what the bloody hell you want. But if you tell somebody that you don't eat meat and that, well, no, we're all programmed to do that. So why are you doing it? There's something wrong with that. And so it's like people are programmed to eat junk food. Does it mean this? Do you see what I mean? And so going outside of that and looking at food has become such an argument that people are getting sicker because of the diet, not weller. So that experiment really hasn't worked, has it, in society? You say animals, because human beings think, I've got this label and I've got this professional label and I've got this. I don't see animals with a label. I don't see animals going to university and learning all these things for years, and all animals know what to eat. They all look perfectly healthy and perfectly fine, and they don't have to queue up at a doctor's. So isn't that itself, and we're nature as well, we are nature ourselves, isn't that itself a message then that you're seeing now, as how you've just explained it, that you've just said it didn't matter what I was eating, and you used some of what you were taught to weaponize against yourself as well, such as weighing food and stuff.
Because one example of that, and it mirrors slightly what you say, you weren't allowed a voice, you weren't allowed choices, so you could only have 3 things that you didn't like. Well, I'm sure there's more than 3 things that you don't like to eat.
Yes.
But you were only allowed 3 things that you could refuse to eat. And if it wasn't on the list, you had to eat it. If you didn't eat it, that was your choice, but you would be punished. Like, you wouldn't be able to have your phone call home or something like that.
So it was like a prison regime.
Yeah.
So ultimately, the very thing, not it's like we look at the reaction, but we're not going to look at the cause. And that seems to be stem out for everything, because it seems to be what the teachings are. Do you see what I mean? So the people, they're trying to do the best, but the teachings, there's something wrong with the teaching, in that we don't look at you as a whole human being. We'll just look at your cause, and what the most unscientific thing is, we don't really know why your body does that. It's like, well, is that because nobody's bothered to look? Or, then should you be treating somebody with a medication if you don't know the full answer?
I don't think that they treat people, they treat the diagnosis. I was seen as somebody with anorexia nervosa, and I should behave like this, and this is what I needed to do, and this is why it was. And once I get to a healthy weight, everything will be all right. And those are the kind of messages that I received. So I ended up being...
Was everything okay?
No, I ended up being discharged from there, being what they classed as a healthy weight, in the healthy weight range. I still had what the diagnosis label atypical anorexia nervosa, which is all the other things to anorexia, but without the weight loss. And I'd also developed binge eating, but the binge eating wasn't seen as a problem because that was keeping my weight up, stopping me having anorexia nervosa. So it was like, there you go, you're discharged, let's go on other groups to try and just learn to cope with this. And
so then what happened with the diagnosis of the OCD and depression? Then
did you move to that? No, they just went by the by, because it was all about the eating and about managing and coping. And it wasn't till I spoke to my psychiatrist and she went, shall I send you on another round of coping skills? And I'm like, no, I'm fed up of learning how to cope. I'm fed up with the voice in my head and I look healthy. Everybody thinks I'm all right, but nothing had changed apart from my weight.
So it's like everything's surface level then. If you look okay and you wear this, you're okay.
Yeah.
So then from that, how long did it take then for you to start to heal, even though they were lessons that you've learned now in looking back? Yeah, because some of the lessons that you've learned now is that when you've realised that you believe that everybody knew better than you, and then you learn a massive lesson that actually that's not true. Yeah, no matter what label you have, that's no one can. You are the expert on the way that you feel, and ultimately you are the expert on you.
But
your body,
like you've said, I didn't think that I did. As I was told, very compliant. Nobody questioned where that compliance had come from.
Right. So from now, or from what you've learned in the present, do you now know that that statement that I've just said? Do you know that everybody doesn't know better than you?
Yeah.
Right. So that's what you've learned from that experience.
No, not from that experience.
Okay.
I still thought there was something wrong with me because I hadn't healed or recovered how they said I should.
No, not back then. Sorry, darling.
Yeah.
Not back then. In the here and now, have you learned from that experience?
Yes.
Okay. So then, when you then went into therapy, how did that happen then? Was it through your psychiatrist, as you were saying?
I went and I said I don't want to go on any more skills courses.
Okay.
And what they saw was the last resort was psychotherapy.
Why was that the last resort?
Because it's long term, or it's because I don't know, but that's what I think they look for. Quick, in my experience, they look for quick fixes with me by and like going on the refeed.
What does that mean then? What does a quick
short-term intervention, refeed you, you'll be all right, and hope, fingers crossed, and hope for best. And I wasn't.
It didn't fix anything.
No.
So how can it be?
It's very
word
short.
In itself.
It's
that
very
word
short-sighted.
Yeah.
Of them.
Yeah, a quick fix. It doesn't. It's a nonsense word. I can't get my head around.
It made me think that there was something wrong with me because I wasn't better like they told me I was going to be, and that they had supported me and offered me all this treatment, and I wasn't getting any better. It was through therapy that changed my outlook on other people and myself.
Okay.
Because for a long time, when I started therapy, I talked about food and all the issues that I've been talking about for the last 10 years. And after a while, it was, when are you going to stop talking about food? And it's like, well, I thought that's what we're here to do. Like, no.
Okay.
And that's when he saw me as a person, not as a list of diagnoses or a list of behaviours.
Was it what you've just said is, that's when he saw me as a person, or was it that's when you'd recognised that you'd been seen as a person? What makes you say that's what he saw me as a person? That is when
he treated me as a person.
He treated you as a person, so you recognised that he was seeing you as a person.
And I started seeing myself as a person.
Right, okay.
I wasn't seen as a label or as a criteria that I had to fit in or fit out of or whatever. Those things weren't discussed. It was about me.
Do you think then, from what you're saying, with the way that human beings have orchestrated that we treat ourselves and each other, is based on a rule in a box that we're not supposed to fit in? Because ultimately, if your body's uncomfortable with something, it's reacting to something that's wrong in its environment. So it sounds like your experiences didn't work because they were uncomfortable. Because you're a human being. You're not a doing. You're not a box. But we become, I guess, as you did as well, become a character, or you have a persona of who you are, and you act out that persona to please everybody else. And if everybody's doing that, if everybody's pleasing everything externally, it's then, who are you internally then? Because it's like you internally isn't welcome on this planet by other human beings. So we make stories up, or make numbers up, or make things up and say, this is how it is, but they don't seem to fit because they're not curing anyone. They're just, I guess, just shutting up the problem. Well, not even shutting up the problem, really. It's like you say, a quick fix. It's like it's not actually fixing anything. So that's what it is.
But I guess to them, and statistically, part of it is a quick fix and a success, because I didn't have the anorexia nervosa diagnosis anymore because I didn't meet the criteria. and I wasn't seen by eating disorder services because I didn't meet their criteria, which was just anorexia nervosa and bulimia nervosa. So I was discharged. So to them, I was a success because I'd been discharged, I hadn't been referred back, and I didn't meet the criteria, and I'd lost the diagnosis with what I went in. So to them, yes, I was a success, but the reality was very
what was
different.
that you'd managed to put a load of stuff inside of you and then put you on the weighing scales, and then you're a success. But you wasn't what you still left unwell.
I felt very confused because it's like, you should be all right now. We've given you all this support. You're at a healthy weight. And it felt like they were saying to me, there's something wrong with you. And it wasn't till therapy that I learned, actually, there's not something wrong with me. I'm behaving normally to the abnormal situations that I've been experiencing.
Would it be, it's not me, it's you? That kind of scenario. Yeah. That it is that human beings react, their actions and reactions, and that they're normal from an.
I didn't know that. I just thought it was me who had these problems. It was me who was a problem. But I learned so much in therapy about being a person and being a human being, and about the way I react, think and feel are results of how this, again, I say phrases that you've told me loads of times, that you're the story you tell yourself. But I learned where I'd got that story from, that negative story of going back to uni, that I was going to fail. It was like, in therapy, we explored that story. Why did I think I was going to fail? Why did I think I was a bad person? Why all those kind of things? And went back and went back and went back, which had never been explored before. And understanding that my behaviours were normal to all the abnormal situations I'd been in. Being in hospital was abnormal. How I was at school was, and being raped as a child was abnormal. My reactions were normal, but they weren't just seen by those that were in my environment as being normal. I was seen as abnormal.
I guess the people in the NHS and your environment, in some that you experienced, and your therapists work for the NHS as well, and so ultimately it's not the NHS as the label itself, it's people. And so it's been known for a long time that if there is a group of people, as I've said before, that are in a group, a homogeneous group, we all behave in the same way, we all normalise it. So if you're trained in a certain profession, and somebody's trained you from a book that somebody else has said, and it looks like it's proved to work, then what you're going to go do is believe that, rather than sometimes question, if I want to do this and somebody's taught me to do it this way, then this is the way that I believe it's been proved to work. Do you see what I mean? Sometimes we don't step outside of that box and say, what if it doesn't? What if it's just everything's based on a belief? So what if it works for the short term but not for the long term? So it's like those people as well. They truly believed that they was helping you. That's what they would believe, because they were taught that. So you see that just because you've come into therapy, it doesn't mean that you're the only person on the planet that's come from an abnormal situation. Just because you're reacting in the way that you are, the majority of us have come from an abnormal situation that we're here to learn from by stepping outside of a box of rules. But we don't know any, when you look at the world, people can't understand that the world could be different than it is now. They can't imagine how it would be without us being dictated to. And we are under a dictatorship. We are constantly told what to do by the cult, and they'll change the law, as they call it, at any time, just as a cult leader does anyway. It can be like this one day, and the next day we're going to do this, and we're going to stop this, or we're going to start this, and somebody will have an idea, and then they'll apply it to every every other human being. And if you don't go along with that idea, you'll bear a consequence. And then from that, what we learn is, because when you're imprisoned, you're in prison, and so because we learn that, so then what you learn is that even the slightest of little rules, such as eating meat, no, you should do it the way I do it. You should do that because this is the rules. This is what I've been taught, and you should believe that. Instead of being, coming outside of the box and saying, is that actually true? And the only truth you can really look to is nature, and say, how does nature survive this? Why are we arguing? And animals know exactly what to eat when they're ill. They know what vegetation to eat. They know all of these things, and yet it becomes such a complication to us because we're being constantly told different things by different people and looking up to their label. So you're saying, well, you became a label, but didn't you also look up to labels?
I did. That's what I'm thinking of. I'm thinking I looked up to them thinking that they knew better than me, and they were right. And they were, some of the professionals that I've come across have been very, like you say, narrow-minded in their field of what they class as their field of expertise, or what they've been trained in, or what their belief. I've come across, thankfully, not my therapists haven't been like that, but I've come across some therapists who have been taught about short-term therapy being the answer, and it can be solved in 6 sessions and that kind of thing, who are very adamant that I must have had rubbish therapists, or that there's something major wrong with me mentally, that I've had to have so much therapy, and that they're quite adamant at that. Your therapist is rubbish, or you're totally mentally ill, you're beyond help, sort of thing. I've experienced that kind of, and to be fair, when I was very vulnerable and before the therapy that I've had, I would have gone, oh, all right, you're skilled, you're trained, you're a professional, because I obviously feel a lot and live in my child a lot. I would go, yeah, you know best, okay, then there is something wrong with me because I ain't got better. And very much like that, it wasn't till you and Jim, who I call my other therapist, he's not called Jim, but I called him Jim, that helped me have my voice, and that, well, helped me know I had a voice, because I didn't know I had one. I just complied with everybody else. Helped me have a voice, but not only just understand me and where I was the story that I told myself and where that come from. That's what everybody else was doing as well. And it was like, wow. And it was a real eye-opener, and it's been slow, sort of like accepting that. But now when there's issues going on, I can see, or I can take a step back. It still might affect me emotionally, but I can see, they're doing that because of where they've come from, the story that they've heard themselves, about what their ego is telling them. And yeah, I might still emotionally respond as my panicked child, or get upset and this, that and other. But I can see the reality, rather than just going, you're an adult, I do as I'm told, which is what I did when I was a child.
It can be the conflict as well. Ultimately it's all a classroom of human evolution, and so we tend to have different personas, different characters. So you can have a character of somebody that's ill with an eating disorder, and so then you can transition into another character that you believe that you are now. So you can have a person that smokes or drinks, and then they would have had that character of smoking or drinking, and what do you do? And everything that we do in our character that we believe, we form some sort of action. We're not made to do that action, but we do it because we believe it. So a smoker then will have to find the money to go and get cigarettes. And that's what they'll do. They'll do the action and go to the shop and buy it because they're a smoker. They've labelled themselves a smoker, but you can't be that without doing it. Yeah, so that's for the majority of things that we do based on our beliefs. I believe this, and so because I believe this, I need this, or this is this for me, and we'll have a story about what it does. And then because we want to make ourselves comfortable, we don't want to do what's uncomfortable. So it's uncomfortable then when you stop smoking. But ultimately, when you stop smoking, then you say you don't have a label of a smoker anymore. You drop the label. So the persona of who we believe that we are, or I have anxiety. I have anxiety because I have a story behind the anxiety, and what's the story? And sometimes it's based on a belief that you believe about yourself. So when you believe that you're not good enough and you're anxious in the world, it's because somebody would have said something to you growing up. And usually, if you don't get it from home, you'll get it from school. Your work's marked and it's not good enough, or you could do better, or things like that. Instead of learning that you were born a genius, you were born with everything equipped inside of you. But when you come onto this planet, we're going to teach you that you don't have anything. We're going to teach you that labels are very important. So you need to work for that label. And when you get to that label, you'll be rewarded. And how will you be rewarded? You might get a little bit more money. Well, we didn't provide that. It's just a story that was made up by people to control people. And we just make stories up. And who's going to, well, we only have the rights to give the money. We only have the rights to print new money. Where do you print the money from? Well, paper. And then where do you get that from? I got it from a tree. Now that's what we do. We make things up out of things, and the stories being made up in the world of things. Like, the story that you've made up in your head. Is it true? Is it true really about you? It's just something that you believe about yourself because you're reacting to something. Then that must be what it all is then. Is that what we're all doing? Because ultimately, we made a story up about this being a table. Yeah, we put things on it just the same as we do to ourselves. We give ourselves a label and we put things on ourselves and we carry them for the rest of our life. But if you took that off the table, and you stripped it back, you'd actually see that it's not a table, its authentic state is a tree. Do you see what I mean? And that our authentic state is a human. And even beyond that, our authentic state is a spirit. And then it's been topped up in layers by another label and another label. This is your name, this is your sex, this is this is that, this is that, this is that. And we end up being buried by being the character of these labels that we're carrying instead of just being a being. And so as your healing's gone, you've shifted in terms of dropping some of those beliefs of that person knows better than me, because no one can ever be an expert on your body but you, because you're the one that hears it, you're the one that feels it. And so no one else can feel it. And quite often you might hear somebody say, oh, it doesn't hurt that bad. Like, how do they know how bad something can hurt inside of you without you telling them? And so, that's what a society that's always telling your body how it should be. And that's what causes problems for us. And as the human species, really. Or in my book, anyway. And everybody else can have their book, but that one's mine. I'm sticking to it. But yeah, so what have you learned about that situation then for you in therapy, when you say, I couldn't be well in a certain amount of sessions? What did you learn that you needed from that?
I find that it surprises me how much I did look up to people, and still do in elements at certain times, and how easily influenced I am and was by other people who I thought were right, and lived my life by what they told me and things. And therapy and I think one of the things that Jim said that I was very fixed before therapy. I knew this, that, and the other, and I was very certain in things. I didn't wonder about things. Therapy opened up the idea of thinking and wondering rather than knowing. I'm horrible. I've got an eating disorder. I want to do this. People are right, and I can't do it. And I was very, very fixed and probably a bit of a challenge to deal with at first. I sometimes think I know what I was like. I know what I'm like now, and I still feel I've got a long way to go. So when I first started seeing you, I must have been worse, difficult, or whatever. But then, what was it like before seeing him? And it just makes me think, oh, things were as difficult as I remember, but I was just told there's not wrong with you because of this, or there's something wrong with you now because you meet this box, but up till you're 20 there were not wrong with you, you're just not a nice person, or your blood tests show this. Never mind what symptoms you got, if the blood tests come back okay, you're okay, and that kind of thing. So
do you think some of that was still fixed when, like you say, when you was with Jim, you were difficult, and then when you must have come across as difficult, and then when I saw you, then you must have come across as difficult, and you didn't come across as difficult. You've never come across as difficult. So, but do you think that was your fixed idea then?
Yeah,
as well?
and I do think it is. I think.
Do you still believe that? Is that what you're still saying? Do you believe that because you were told you were difficult back then, that I too think that you were difficult?
Yeah, I think as Jim had said, that I'm rubbish at reading minds.
Yes.
But I think I know what you're thinking about me. I did a talk this morning to some nurses, and I think I can read what they thought about me and read their mind and think they thought this and they
so
thought
you're
this.
going to think for them.
Yeah.
Yeah, and you're going to gaslight them as well.
Yeah.
And that's what.
If they say something nice, I'll probably say, well, they're just saying that to be nice to me, sort of thing. But now I can talk myself round and have a conversation with myself and say, you don't know what they're thinking. Why would they send an email saying thanks, it was brilliant? If it wasn't, they're not just being nice, they don't have to be. So I can talk it through, where years ago I would have said the two-faced liars, and I knew that, and I couldn't be.
Would you
moved on that?
Do you speak about your experience of the NHS to the NHS to, does that feel like a balancing out of what you've experienced in there?
I'm honest in talks that I do, and I have done some to different levels within the NHS. I've done the board of directors at the mental health trust, and like today I did some community nurses, and so I've done people on the ground and people higher up and stuff. And
higher up
in the hierarchy,
right? Okay. Does that actually exist, higher up?
It does within organisations, but we're still people.
So what if you
I say the same?
Yeah. Isn't it then? It's just different.
Yeah.
Yeah.
And I think,
do you have to go along with that made up hierarchy then, or don't we act that out? It can never exist unless we act that.
I think sometimes I do buy into it, but I think
so people that you're not allowed to speak to him up there.
Yeah.
Because of a label, a made up label. So you're not allowed to speak to him. But as a human being, we're all on the same level.
At work, because obviously I worked and learned discipline. Oh my goodness, I soon worked out what I'd never experienced it before, but I soon worked out what it was, that in the hierarchy they could contact you, so the CEO could email you or ring you and ask for something straight away, and anybody within the hierarchy could ring you. But if I wanted to speak to them, I had to go through my supervisor, who went through their supervisor, who went through the area.
Don't you think it's a silly game?
And
it really is.
Like, it's like, all right, I learnt that really quickly by responding to the CEO when I should have gone through the lanes.
So somebody else has to contact somebody else, has to contact somebody else, has to contact somebody else to get to that person because they've took that label on and they're so they're really special when they're up there then.
But they can speak to whoever they want.
But you
But
can.
I couldn't speak to whoever I wanted.
Right. So when you go into a job, you accept, as I did. I think I don't like being told what to do anyway. But you accept that that person's above you because of the label, and because they're above you, you can't talk to them. Okay.
Yeah, and I've never heard of lane discipline until then, but it was like, yes, okay, right, I've learnt my lesson now.
Okay.
But within the NHS now, I guess what I do is I will say the same regardless of what role they're in. The only difference is that I've noticed from them is that the higher up they go, they want to know what you're going to talk about first. When I've done this morning, they just wanted the title of my talk. That's it. Okay. When it was higher up to the board, I had to fill in a form first, labeling everything that I was going to talk about. Basically, give them a script. And one of the questions was, am I going to talk negatively or positively about the services that I have received from the NHS? And they wanted to know those things in advance. So that's one thing that I've noticed from them. But what I deliver or say to them is similar regardless of what role they have within the NHS.
Okay.
And like I said...
So do you think even in that you can still see the little boxes that almost what are you going to talk about first? It's almost like do you have to pass through a gate? Is there something that you say I'm going to talk about that would say no, you can't? I mean, I guess there's some things that might not be appropriate to talk about, but it's that level of understanding of always having to pass something, having to do something. You can't just talk to one human being to another. It has to be almost building a character in itself.
And I think some people fear what you're going to say and want to be prepared for it. Right. So they want to know what I'm going to talk about.
So that it's going to be appropriate for that situation.
Or is it going to be positive or negative? Well, I put down what I say to anybody. I'm just telling the truth. You decide if it's positive or negative. I'm just saying, this is what happened to me. This is what I've been through. This is the treatment I got. This is how I responded to it.
I think in saying that is a world of, it's almost a world of shh, that we don't say anything. But ultimately, there are three big killers in the medical books for America, and the research was done, I think it was 2016 in Britain as well. And the first one is heart disease. The second biggest killer is cancer. And the third biggest killer is the wrongly prescribing by doctors. Now, should wish about that, wouldn't you think, I mean, I don't know if you already knew that, but wouldn't you think that should be something that's spoke about? Because aren't we heavily relied on, as you were, shouldn't we be looking and seeing what are we doing? What's working really and what's not working? Why do we keep doing the same thing and you keep getting the same result? Isn't that, as Freud said, it's madness? And so that's a kind of scary figure. It's like, then what's happening? What are we doing about? What's being done about that? So when you say we don't want to hear this or we don't want to hear that, it's like this. Well, we need to hear these things so we can have a look and see what's going on. as you say, we say in therapy, moving the spotlight.
Mm.
So we move a spotlight on somebody that we want to blame. Do you see what I mean? I want to blame that person, so I'm going to move the spotlight and say all these things about that person. But in the background, outside of the spotlight, we rarely look to see what's happening. We only look at that. You see, we're being directed to look at that, but we don't look and see what's happening and say, so we believe that. We believe what we're told. We believe where we're directed, but we don't look over our shoulder and say, why have I been directed here? Why, let me investigate this. Let me have a look at that for myself. We trust labels, and yet we don't like them. So why do we trust something?
It's funny that what I see in the media and what people within services say is that we want to get rid of the labels, we want to do this. However, society relies on labels. If you don't have a label, you can't get anything. I know like when
we shouldn't have any, we're human beings.
Yeah, but I can remember years and years ago, I had to fill a form in, and at that time the psychiatrist that I had was very move away from labels. She was the one who referred me to Jim, so she very much saw me as a person, and didn't use labels with me and stuff like that. She didn't want to label me and stuff. And I remember that I had to fill a form in. I can't even remember what it's for. It's something minor, whether it was car insurance, holiday insurance, something. But I said, I've got to put my holiday, and I've got to put my needs in my thing. And she came out with this long spiel of that you've got debilitating issues stemming from childhood trauma. I'm like, that want a drop-down box. I've got a drop-down box to pick from, and these are what I've got to pick from. Which do I pick? And it was like, even though we're very vocal about we don't see people as labels now, we're looking for human beings, we're looking for behind the label. Society isn't built like that, like filling in forms to get benefits. If you ain't got a label, even with a label, they'll call you a liar and gaslight you and say, with my eating issues, I got told I show no significant signs of distress when I'm suicidal, or that eating disorders are a transferable skill, so it's not classed as a problem. So
an eating disorder is
it's a transferable skill.
A skill?
Yeah.
Oh, wow.
I have, because my mum's elderly and I look after her, if I can look after her, there's no reason why I can't look after myself, and it does use the word transferable skills.
But there's no words like toxic relationship or unhealthy relationship or things like that. I guess it's just that the same thing as, or similar thing how I'm seeing it is to, as long as you're at this weight, I don't care what crap you put inside of your body. But I think overall, when you speak about labels, and you've learned quite a lot about that, is that when we start treating ourselves as a being and not a doing, and so when there's a war over there, instead of getting involved in it, if we just turned away from it. So what I mean by that is society isn't that important to an individual. And if the individual looks within themselves, where you've been equipped with everything, it's like we add things like your finger can cut itself, and yet we'll add and say put a plaster on. Plaster doesn't heal you. When you break a leg, the pot doesn't heal it, it just holds it still so it can heal itself. We've already been equipped with everything, but when we're being taught that we've been rendered useless basically by other human beings, and you've got to ask yourself the question, why? Why are we put in these boxes and controlled and told what to do when your body's saying that's wrong? And so ultimately, that still happens regardless of whether you come to therapy and heal from all your childhood traumas or not. There's still the toxicity gonna remain in the world as as when, because people believe,
Mm.
we believe what we're told, we believe where we're directed, we believe that we must, we should, we have to.
And the
we've got
infrastructure
to,
around society holding it together,
the way
or
that
whatever,
it is,
the way that it's
holding it the way that it is,
way that they've built it,
yeah,
is built on those very things that we want to move away from. So it might be, yes, if we're all moving away from labels and that kind of thing, but those people struggling with their experiences will be disadvantaged because of it.
And it's that looking at the picture, look at what nature does, and then look at what we do, and see that we're stressed because